How to isolate a leak between the anesthesia machine and the insPurr ventilator. Proceed to the initial leak test. Power on the ventilator. Follow the steps of the leak test. Place a cap on the patient tubing. Close the evacuation valve. Open the flow meter to 0.5. Press the flush valve to inflate the bellow. Start the test. The leak test has failed. How to isolate the insPurr ventilator. Follow the leak test steps again. Remove the insPurr tubing from the anesthesia machine. Seal it with your thumbs, or the palm of your hand. Start the test. What to do if the leak test fails again? Inspect the tube for any cracks. Ensure the connector is securely attached. Remove the bellow housing. Ensure the O-ring is properly sealed. Ensure there are no cracks in the bellow housing. Remove the bellow. Ensure there is no cracks on the bellow. Ensure the mushroom valve is flush. Reinstall the bellow and housing in place. Make sure it is sealed properly. Follow the leak test steps again. If the leak test is successful, you're good to go. If the leak test fails again, Contact your DispoMed technician for inspection and troubleshooting.